Hi, welcome. Dr. Alex Perry here, editor of Chinese Medicine Digital Magazine. I've got with me Dr. Franco from Italy.
Hello.
Nice to meet you.
Very nice to meet you.
Thanks for coming and talking to us. We're here at the WFAS conference in Darling Harbour in Sydney. So you've come all the way over from Italy?
Yes, I came from Florence. I have a school in Florence with many students. They make Tuina, acupuncture, Taoism, diethology, and many different practices. I'm from WFAS for many years.
Sounds very interesting. Franco, tell me about the situation in Europe in terms of acupuncture and traditional medicine and Western allopathic medicine. Is there a way that the two are working together?
There's many different type of teaching, and one proposition, Lanois, 1997, warned every part of Europe the same practice, the same qualification, but after in Europe it's not like this. In some part, like in German, Heilpraktiker, in other part, like in Italy, acupuncture for medicine, and Chinese massage for therapists is really changed. But we have many operators, and we have 10,000 acupuncturists in Italy.
10,000, wow.
10,000 acupuncturists in Italy, and one law now from 6 months. They give 2 years for university, and 3 years for private school for practice teaching of acupuncture.
That sounds terrific. And you were telling me before about the way that acupuncture is being incorporated into the hospital setting. Can you tell me a bit about that?
We have one extraordinary experience in Italy. Is hospital of Pitigliano. Pitigliano is an institutional hospital from Toscan region. We treat inpatients with acupuncture, homeopathy, and allopathic medicine.
In an integrated way.
Integrated. We make breathing with many medicine. We make semiotic integrated. And this is really interesting because we treated 12,000 patients in 2 years.
Wow.
With very important results. This is changing opinion about the people, changing opinion about institution, because it's a new type of thinking, a new type of vision of integrated medicine.
That's fantastic. And in terms of the practical part of integrative medicine, when a patient comes to the hospital, who takes the lead for that patient's care? Is it the acupuncturist? Is it a physician? How does that work?
It's important integration for therapists. Is this, and it's important to look one person with integrated vision and with integrated therapist, massage, dietology, respiration, qigong, tai chi chuan, spirit of life, because the Tao in Chinese medicine is the street. So when you treat one person, you treat not only with acupuncture, but only with one different thinking, with one different type of food, with one different type of respiration, because respiration and spirit have the same root. So we make this in my study. We make many techniques: reflexology, sujok, diethology, phytotherapy, Chinese, Occidental phytotherapy. We integrated many connaissances.
That's amazing. And is this a first for Europe, or is this being done elsewhere as well?
No, it's many experience in Italy. In Italy we have many study, many ambulatory, they make the same thing.
That's fantastic.
Now for the fertility, for example.
Yeah, so Franco was telling me about fertility. What's your experience with fertility? How are you addressing fertility issues in Italy?
We treat many double, many men and women, because about 5 or 6 have this problem in Italy. Is one problem very big. The acupuncture can treat for PMA, allora FEVT, ICSI, allora fecundation in vitro, and help very much 20% have a good result with acupuncture before the transfer and after the transfer, 2 seances. But I prefer to prepare the double, prefer men and women, because sometimes they don't need fertilization in vitro, because you must change energy, qi. You must tonificate shui, the blood, Genier, the water, the liquid. This is really important, because infertility is a disharmony, and this disharmony is the spirit, the Shen, the first problem.
That's terrific. Dr. Franco, it's been a pleasure.
Very nice to meet you.
Thank you for coming all the way from Italy to meet us. And we'll have a link to Dr. Franco's website so you can get in contact with him if you're interested. Thanks again.
Thank you very much.
All the best. Thanks.